We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for health system CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now. Welcome to the Health System CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jasmaine McClain, Executive Director at the Health Management Academy and Health Equity Officers host. And together, we'll explore equity in plain language and assist you as you navigate the complex structural challenges associated with system transformation and health disparities. Welcome to the Health System CXO Podcast. Today we have Dr. Joseph Betancourt joining us as a guest for today's podcast. Dr. Joseph Betancourt is president of the Commonwealth Fund. He formerly served as the Senior Vice President for Equity and Community Health at Massachusetts General Hospital and is founding director of the much-beloved Disparities Solutions Center. He has devoted his career to improving the quality and value of healthcare for diverse populations. Dr. Betancourt, thank you for joining us.
Thank you so much for having me.
So a little fun fact, you may not remember this. We connected back in 2015 for an interview on your work at MGH at the time. And it feels like a real full circle moment to have you back on the podcast to talk about all things health equity for our audience. So I'm excited to catch up and hear about the work that you're leading now at the Commonwealth Fund. We'll get started with just a question on your career. And one of the things that we really love to do with this podcast is to use it as an opportunity to connect with health system CXOs across all parts of their career. And I'd love to hear what is most surprising to you as you think about your journey as a healthcare executive across your career.
Well, thank you. And it's great to reconnect once again. And yes, I'm in a very different part of my career right now. And that's a really interesting question. You know, I've been a clinician now for some 25 or so years, really had the good fortune of crafting a career in the area of health equity, which has, I think, been a dream come true in many ways. And I think when I consider what's been surprising over the kind of arc of my career, there's a couple of things that jump out. Some probably more in the rearview mirror and some in my current view. You know, I'd say as I think about the rearview mirror in the past, when I began this work in the late 90s, I had the good fortune of really being part of an Institute of Medicine study committee that released a influential report at the time called Unequal Treatment. And I think one of the things that has surprised me is how far this work has come since that moment, yet how much work still needs to be done. You know, that was a seminal moment in 2003. We just celebrated the 20th year of unequal treatment. And I think I couldn't have imagined how, I think, central a topic equity would become in healthcare on the heels of that. But I've also been surprised that the tangible work and really eliminating disparities in health outcomes has yet to be achieved. And in some cases, those gaps have not only not narrowed, but they widened. So, you know, that there's surprise on kind of both ends in relation to that rearview mirror. I'd say current day, the other thing that's been surprising, it's also a kind of a bit of a paradox, is how much progress we made in 2020 on the heels of our national reckoning on racism and COVID and its impact on vulnerable populations and our conversation that advanced health equity. And then how much just in the last couple of years that kind of boomerang effect has occurred, in which there's a real weaponization of kind of topics that I think we all agreed on. The simple fact that if someone comes into a healthcare system, no matter who they are, where they're from, they should get the highest quality care we have to offer. Even things as basic as that have been weaponized, and certainly diversity and inclusion even more. And so that's been surprising. I couldn't have imagined how much ground we would grab, and I couldn't imagine how much kind of pushback there would be. The last thing I'd say, I think, is one of the things that's really surprising to me is this incredible focus we have now on the corporatization of healthcare, the corporate drivers of healthcare, and this real imbalance, I think, between revenue/profits versus patients, and the impact that's having on health outcomes, on the healthcare workforce. So probably more than you asked for, but I just thought I'd kind of give you a little bit of the past, the present, and the future.
Yeah, I love that. And looking back and looking forward, I think is always such a helpful reminder for folks as we think about how much we have to accomplish and continue to focus on, particularly within healthcare, but I think just across the work that's happening in society today. So let's talk a little bit about your work at the Commonwealth Fund. You were named as president of the Commonwealth Fund in January of 2023. What role does the Commonwealth Fund look to play in advancing health equity?
Yeah, well, thank you. I mean, I think, this is also a full circle moment for me. I was a Commonwealth Fund Fellow in Minority Health Policy, fellowship that was created at Harvard University by Dr. Joan Reed in 1997. I was in the second class of that fellowship. So it's a full circle moment for me because the Commonwealth Fund was really, really cutting edge and really, really ahead of its time, looking to build leaders in health equity in the late 90s. And so I did that program, and now to be able to come back and be president of the fund, I think is just an incredible blessing and something that I feel very privileged position to be in, but also feel an incredible sense of responsibility and urgency to carry that torch forward. We're a foundation, the Commonwealth Fund, that was founded by a woman, and I think that's important to call out. And we're over 105 years old, and I think the beauty of the Commonwealth Fund is that it has always been bold and impactful in its work. From its early days, funding the first public health departments, rural hospitals that led to the Hill-Burton Act and the construction of hospitals nationally, the first advanced practice practitioner programs, the science behind the cervical cancer screening and the pap smear, all these things, first medical schools in urban areas. All these things, I think, were really, really important in our inception, and then moving towards some of the research that led to the Affordable Care Act. And equity has always been a key thread throughout our history. I described the way equity touched my career, and certainly today, Advancing Health Equity is our largest program among 8 programs and 2 special initiatives that we have. We really focus on leadership development through our Commonwealth Fund fellowships, both at Harvard and at Yale. And we engage in a lot of work around policy and practice related to health equity, really now focusing on how we could better kind of spur change through payment policies that promote equity, regulation that promotes equity, engaging healthcare system leaders to measure and track their progress. So we have a broad portfolio here. And I'm excited about taking that forward. I mean, I think my hope is it will be part of my legacy as a president of the Commonwealth Fund.
That's wonderful. And are there places where you would say you're seeing some of the greatest needs across the healthcare ecosystem? What are the things that you all are thinking about in terms of prioritization?
Yeah, I think one real important realization for me, a very significant realization for me as president of the Commonwealth Fund, is someone who I think engaged in a lot of aspects of healthcare policy and practice during my career, but was really focused on equity. I think now more than ever before, I see with real clarity the importance of us addressing a lot of other issues in healthcare that fundamentally will improve health equity. So an example, I'm a primary care doctor. We're in the midst of a primary care crisis. You can't achieve health equity without really shoring up our primary care infrastructure, primary care workforce, and our primary care delivery system. And so while people might say, well, primary care isn't health equity, I would argue it fundamentally is. And so I think we're going to put a lot of attention to that. We have programs on Medicaid where, Medicaid payment and reimbursement is a major issue across states. There's still a need for Medicaid expansion, opportunities in 10 states. I mean, that is a health equity issue that's really, really critical. When we think about what I mentioned, the kind of corporate drivers of healthcare and how that is becoming imbalanced and it's having an impact on health outcomes, it's always going to disproportionately impact vulnerable populations. So that is a health equity issue. Even things that we're talking about, like artificial intelligence and the importance of thinking about equity in that context of what the future of healthcare is going to look like, that's a health equity issue. So in this role, I've had the benefit and the privilege, again, of broadening my aperture and really thinking about equity in everything we do while shoring up a very strong health equity program. And so it's a wonderful opportunity now to have a bit of a blank canvas to think about our nation's large crisis, many healthcare crises, and how equity fits in.
Yes, yeah. And I think the importance of remembering that it's not a siloed kind of body of work. And I think that's something that we talk about a lot in healthcare, just given the fact that health system leadership is complex and healthcare leadership is complex. And I think folks often struggle with how do we think about advancing equity in a way that is concrete, in a way that is strategic, but that isn't too diffuse, right? That isn't, lacking a sense of priorities. And so I think having that wide aperture and being focused around how you advance that from your lens and your platform is so important. So one of the things that we look at a lot is your state health disparities report at the Commonwealth Fund. And you all released the 2024 state health disparities report. What are the key findings that you would say health system executives need to know from that work?
Well, I think there's several. We looked at 30 some odd measures in three areas: health outcomes, access, and quality of care across 50 states and the District of Columbia, and created a scorecard ultimately that ranks states. And, there are a couple of key things that jumped out. First, I think this is really, really critical. Disparities in health and healthcare exist in every single state. So no state has got this figured out. That's a key point that emerges from our report. I'd say second, and this is really critical, especially given that I've spent the majority of my career in Massachusetts, which in our general scorecard, as well as our health disparity scorecard, ends up being first. But the key finding here is that even states that are high performing in general still have disparities in health and healthcare and opportunities for improvement. I'd say third, there are certainly differences in the disparities that exist between states, and some states perform better than others. And we could identify some characteristics that differentiate the high performers from the low performers. Okay. And among the high performers, we definitely see that high performers have committed to making sure that as many people within their state have health insurance. Second, we see that states that are high performers really make greater investments in the social drivers of health, whether it be social safety net and efforts to address the social drivers. So that's really, really important when we think about health outcomes and health disparities. And third, I think we do see healthcare ecosystems among high performing states that have tended to prioritize health equity in some way, shape, or form. And so, every state has work to do. Every healthcare system has work to do. And I think the challenge now for healthcare leaders who are listening to this is to go to our report, take a look at your state, look at where your state is falling short in quality in particular, or access or outcomes. Think about the things that you could control, and hopefully set some goals and hold your healthcare system accountable for making progress, so that when we do this again, we see improvements in every state.
Yeah. And I think also to your point, looking for those bright spots of really learning from what is happening in other states, what's working, how are we starting to close the gap as it relates to some of those disparities. And I think, you quoted at a National Academies meeting last year, one of the things that you said, which I thought was so important, is the resistance to this work is really strong, but strategy and resolve are stronger. And I think reminding yourself of that as a health system executive is so important, because you really can move the needle in a concrete way within a defined period of time. So I'd love to hear about it. Yeah, go ahead.
No, I was going to say to that point, there are many ways in which health disparities, to my earlier comments, have gotten politicized and weaponized. And I think as a healthcare system leader, you really should be immune to that, because at the end of the day, our greatest responsibility as healthcare system leaders is to fundamentally assure that everyone gets the highest quality care, no matter who they are, where they're from. It's not political. It's really an essential tenet of quality of care and healthcare system's mission. And so, my view is that healthcare system leaders, among all those in the healthcare industry and the healthcare continuum, should be able to get the most done in this space, free from some of the other things that might politically or otherwise tether progress.
Yeah. So what's keeping you energized as you think about some of the bright spots that you're seeing in your work and, certainly in your network? What would you highlight across the industry as it comes to moving the needle on health disparities?
Yeah, I feel blessed. I think I have the very privileged opportunity now to be at a very historically impactful foundation that has been able to contribute to to improvements in health policy and practice, achieving our mission of affordable, high quality healthcare for everyone, and now having the opportunity to have somewhat of a blank canvas to think about where can we best leverage our assets for impact. And in the health equity space, clearly a couple of things jump out. I do think that we've seen a lot of progress over the years among those early adopters and progressive leaders and those individuals who fundamentally believe this work is important and I would argue the nice to do. I think we need to pivot now to the need to do and accountability, and we do that through payment and regulation. And I do think it needs to be a combination of carrots and sticks, but at the end of the day, if we look at the quality movement, if we look at the safety movement, those same tools have been used to advance those movements to see the progress we've seen in both of those areas. And they were hard at times, they were challenging at times, but building that accountability really changed the landscape. And I think really moving to that space in health equity is what I'm really excited about. I think there's no doubt that despite the pushback, there's incredible energy and durability around the importance of addressing health disparities and health equity. And I guess last I'd say that, this new generation, I think is fundamentally committed to those principles of high quality care for all. So that's inspiring, and how we catalyze that energy and fuel it, I think is going to be really important. So a lot of exciting things and a lot of great opportunities. I'm a glass half full person, have been my whole career. So I'm looking at it that way. And I think as I look back at the last 20 some odd years in this space, we made progress. We're not where we need to be, but you also realize that this is the long game and we have people we could pass the torch to and take this work forward. So I'm excited about that.
I love that. I think I've said in one of our previous episodes, I'm an aggressive optimist, and I think you have to be a lot of times when it comes to continuing to push forward, even if you take some steps back along the way. So our last question, what words of wisdom would you offer to health system CXOs to drive sustainable systemic change, particularly as you think about the era of political and social complexity that we find ourselves in?
Yeah, my big advice is treat health equity just like you would quality, safety, value, anything else that you as a healthcare system hold yourself accountable for as it relates to performance and health outcomes. Right. That's what we are here for. And up until the point when we do that and we take it seriously and we really build, it's not rocket science in my view. You collect the data, you measure your performance, you identify gaps, and you build in the necessary interventions to address them. I think that's what I'm hopeful that healthcare system executives will do. And it doesn't need to be overly complicated. I think a lot of this is kind of basic strategies. We don't need a lot more research on what works. Plenty of examples. It is about building them and integrating into the system, not bolting on, but building in. And holding ourselves accountable for that performance like we do in other areas. I think that's really critical, with the underlying notion that as we do this, we will improve care for all, because the issues that lead to disparities impact all populations just at different rates. And so fundamentally, our work in the equity space has been demonstrated to and will continue to improve care for all. And so I think that driving set of ideas hopefully could propel this work forward in the years to come.
Perfect note to end on. Dr. Betancourt, thank you for your time today. Thank you for joining us on the Health System CXO podcast.
Great. Thank you so much for having me, and I wish everyone good luck.
Bye-bye. Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so you never miss an opportunity for insights. If you like this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.